All right. So I want to thank you all for inviting me to discuss traveling with dialysis or transplant. I think it's actually a very important topic because, and it's also very well timed because we're starting to think about the holiday travel season, and this is the time to think about it because if you're thinking about traveling, like Thanksgiving, Christmas, New Year's, you're going to have to start notifying, your dialysis center if you're on dialysis or if you have a transplant, you have to talk to your transplant center to find out, hey, can I go for, travels and stuff and what are the things I need to worry about? So, with that, let's start. So the first thing is can I travel with kidney disease? And absolutely, that is a resounding 100% yes. But you need to be well prepared. And there are so many websites out there, whether it be, you're going to state.gov and there's a travel website, I think it's travel.state.gov, and you can look there. You can go to the CDC's website to find out if you're doing any international travel, like what are the things to worry about. And so I'm going to go through some of those other things that you should be prepared for when traveling, when you're either on dialysis or having a transplant. Basics. I have a lot of basics listed here, and that is because I'm hoping you'll be able to go back to this presentation and you can see all of these basics again and kind of make your own checklist as to what do I need to make sure that I have if I'm traveling. And so first, of course, you're not going to be able to get anywhere unless you have a valid ID. And pretty soon, I think that real ID is going to be enforced. So make sure you have a valid ID, possibly a real ID. And the big thing is multiple copies of all of your travel documents and all of your medical documents. You want to make sure that you keep one at home, that you have one to a loved one so that who's not traveling with you. So in case something happens, they have a copy of your ID. You want to make sure that also your travel companions have copies of your ID, and you should probably have copies of their ID in case anyone loses it. Health insurance card, same thing, front and back. Make sure that you have your actual card, but make sure you have copies and keeping appropriate copies with appropriate people as well. Know where you're going, and I don't just mean like, oh, we're going to travel to the Caribbean, maybe to the Bahamas. Yep, we're going to go to the Bahamas. No, no, no. You need to know more about it. You need to know, are any vaccinations required in order for me to travel to this place? We've gone through a pandemic. All of the traveling has really changed with that pandemic. And some countries might have like higher rates of disease, such as COVID, and some countries don't have as high of rates. I know, for instance, years ago, I changed my travel plans when we were going to Iceland because at the time they were having a high rate and I didn't know how their hospital system worked. I didn't know did they have a lot of hospitals or not a lot of hospitals? What was their, COVID plans? And so we actually rearranged our trip and delayed it for a whole year until the COVID had gone down to safer levels. So you want to know, are any vaccinations required? If that's the case, make sure you have a copy of your vaccine card as well with you, okay? You should probably carry that anyway, but always have that vaccine card so you can show it in case it's needed. Are there any endemic diseases in this place? So where are you going? It could be as simple as going to Ohio and knowing that there are certain fungal infections that are more prevalent in Ohio, or maybe you're going to the Southwest United States. You want to know those things ahead of time so that you know what you should do in protecting yourself. Maybe if there are fungal infections that are more prevalent, you might want to wear a mask in some of these places if you're like out and about with nature and you know that fungal spores can be carried on the land. You want to do something like that. You also want to know what is the emergency response system? So if you're traveling outside of the United States, what is their emergency response system called or what's the phone number? Here we just kind of call it generically 911 because that's the phone number you call and that's how you get through. Well, if you go to the UK, for instance, and you're having an emergency and you need to go to the emergency room, they don't call it the ER, they call it A&E, accident and emergency. So you want to know the lingo of wherever you're going and how to navigate their healthcare system. You also want to know what's the emergency phone number you need to call. And if you're international and you have a phone with you, do you have to dial a country code before you dial that emergency number? Make sure you know those things and maybe plug it into the phone ahead of time so that you know, like, okay, I'm going to India. And I know that in order for me to dial their emergency phone number system, I have to dial the country code and then the area, whatever it might be. So maybe you just plug that in ahead of time so you know exactly what it's for. Are your medications allowed to be brought there? There are some countries that consider some of your medications, they might consider them illegal. Maybe someone is on Marinol. Marinol also is a medication that can increase appetite for patients, but it is a marijuana derivative. That might be illegal in some countries. And so it's important to know that the medications you're bringing, are they going to be allowed to be brought in? Maybe you have like a cough medicine and it has codeine in it. That might not be allowed. So you have to find out ahead of time, are your medications allowed to be brought there? Also, health insurance. Okay, here you just give them your health insurance card at the hospital and whatnot. I mean, sometimes we have to deal with like, is my insurance accepted or not? But in the United States, we have a system that the emergency room can't turn you away regardless of your insurance. But over wherever you're traveling, do they accept insurance? Or is it fee for service? If it's fee for service, do you have to pay ahead of time? Is it cash based only where you have to have, go to an ATM and actually have cash on hand? Or do they allow credit cards? You need to know these things in advance so you are prepared. Your itinerary. Again, share your itinerary with people. Make sure they know exactly where you're going. Maybe even share it with your doctor if needed, or like, sometimes my patients might tell me, "Hey, I'm going to this place or this place, and I'm just sending this to you on a my like." I work at Loyola, so it's called a My Loyola message, and they'll tell me where they're going, and I can just put it into their chart if I need to. Things like that. Other basics. Your current medication list. Make sure it is up to date with your current medications, the dosages, generic names, brand names. Why do I say that? Brand names are not good enough for a lot of places because what might be a brand in the US might not be a brand over in Mexico, or maybe it's not a brand in Canada. And so a brand name is not that helpful. You actually need the generic name, which is usually the longer name on most drugs, and it's usually the one that patients can't pronounce. Most patients can pronounce a brand name, they can't pronounce the generic name as well. But you want to make sure you have all of that listed, the dosage of the medication, how often you're supposed to take that medication. You also want to have a list of your allergies. And again, these should all be shared with the person at home. There should be a copy left at home. There should be another one with the loved one who's not traveling with you, and your traveling companions should know how to access your medication list and your allergy list. With your allergies, you definitely want to state what your reaction is to whatever is listed, because otherwise people won't know, and we need to know, is it safe? We have a lot of antibiotics in the US. Not every country has all of these antibiotics. Maybe you are allergic to something like penicillin, but it only gives you hives, and that's what they have easy access to. They might just have to give you penicillin. It's a list of, it's essentially the healthcare providers then going through risk and benefit of giving you a drug that you might potentially be allergic to. But if it says that you are allergic where you're going to start swelling up and you can go into anaphylaxis, not going to do it. Make sure you have the information for your all of your providers, your doctors, what clinic they're at or where you see them, the phone number, the fax number, and what they treat for you. Okay, so it's important to know. Dr. Lee over there is the doctor for me, but he is my ear, nose, and throat. I see him for my sinuses or something. Okay, fine. But this doctor is my primary care doctor. This doctor is my transplant doctor. People need to know who your providers are, how to reach them, and what they treat for you. list of your current medical conditions. You might think that, oh, if I just show them my meds, they should know what my medical conditions are, but maybe not, because maybe you're being prescribed certain medications that are maybe used usually for like diabetes, but in this case, they're being used for something else for you. So you want to make sure you list your current medical conditions as well. It's very helpful if you have a copy of your labs, preferably if you have copies of maybe the last 3 sets of labs that you've had. So that way, if you do get sick or you have to go to a hospital or an urgent care and they're looking at your labs and they're like, "Uh-oh, this is abnormal." But if you have the trend or the history, maybe they'll say, "Oh, this is actually quite normal for you. I don't need to worry about this." Okay. Advanced directives. So in the United States, we take that very seriously to always try and honor someone's advanced directives. I think it is appropriate to always bring your advanced directives with you and make sure that, again, your travel companions know what your directives are. If you don't want CPR, that should be known. If you don't, if you want to be resuscitated, that needs to be known because I don't know what every country does. You don't know, like, are they going to do all efforts or not efforts? But it's important if you have that copy of advanced directives. Again, all documents, copies, one at home, one with someone who's not traveling with you, and then make sure that your travel companions also have access to your documents. You also want to think about travel medical insurance. So, this is different from travel insurance. People might have trip insurance or travel insurance, which is just like flight coverage, maybe a hotel coverage if something happens with the flight. But travel medical insurance is also known as global health insurance or global medical assistance. And you want to make sure that you have that as well because of the fact that, and we'll get into this a little bit later, but if an emergency happens, you want to know like how that emergency can actually be covered. And global health insurance will help cover that for you. So let's start with hemodialysis. So if you're on hemodialysis, and I mean at a center where you're going for dialysis, what should you know about traveling? What are the considerations that you need to think about? One, don't finalize your plans until you've spoken to your provider, your social worker, and hopefully you already then have started arranging plans at a transient dialysis center. So, a transient dialysis center would be the center that is not your permanent center, but one that you are going to dialyze at while traveling. Okay. Consider to be flexible on your dates. It's possible, like spring break is a very popular time to travel. Maybe a lot of people go to the same location for spring break. Guess what? Those transient or the dialysis centers, they may not be open for every single visitor then. So if you can consider to be flexible on your date, then that is something that's really important. You also want to realize that the dialysis center, the transient one, may not be the same time, day, or shift as your current one. Maybe you're currently doing Tuesday, Thursday, Saturday mid shift, but they can only get you Monday, Wednesday, Friday late shift. So you have to be flexible with that and know that that might be what you're going to have to do. It also might not be the closest dialysis center. Maybe the closest one is only 2 miles away, but they didn't have room for you traveling on dialysis. But then there's another center that's 7 miles away that does have room. And so the dialysis center might not always be the closest to your destination. Once you do know which dialysis center you're going to, you want to give them a call and make sure that they have the correct dates confirmed for you, that you have the correct day of dialysis and the time. When are you supposed to be there? And the location, is there parking on site, off site? Those are all important things for you to know. Travel with a copy of your dialysis records. Ideally, your dialysis center will be sending your dialysis records to the dialysis center, but we all know things can happen. Things can get lost in transit, even through fax. Papers can get shuffled around. Maybe the center received it, but they didn't realize and they didn't know who this patient was, and they toss the paper. So travel with a copy of your dialysis records, including your prescription for dialysis. So every dialysis, there is a prescription, whether or not you know that, but it tells the provider like how many hours you dialyze for, what's the dialyzer that we use, what's, your blood flow rates, your dialysate flow rates, all of those things are part of your prescription, including your dry weight. Make sure you know your dry weight, by the way. Say that at the end of the at end of dialysis, I'm usually 70 kilos. And so that the dialysis center knows that you're trying to get to 70 kilos. Or if you've been above your dry weight persistently and you can't handle going to your dry weight. Or if you drop your blood pressures in dialysis, make sure that the dialysis center has enough information on you about these things. Always carry your health insurance card and your ID with you. Ask that transient dialysis center before you travel, when you're finding out and confirming with them, what other information do they need from you? What information do you need to provide? What information are they missing that was supposed to be provided by the dialysis center? You want to know those things. Make sure, again, that they're aware of your special needs. Some patients might require midodrine. Midodrine is a drug to increase blood pressure uh, before dialysis. So make sure they know that if you need to take that beforehand. Um, Make sure that they know all of those things that might be important, like you cramp up if you go a little too long, or if they pull off too much fluid at a quick rate, you'll start to cramp up. That's important for them to know. If you've ever had a dialyzer reaction, make sure that the dialysis center knows, like, oh, this person had a really bad reaction to this dialyzer, and hopefully your dialysis unit has elaborated that to the dialysis center as well. And then lastly, your transient center should know where you're staying. They should know your contact information of where you're staying, what's the best way to reach you. They need to know those things. How are you getting to them? They need to know those things. So, home dialysis. Is home dialysis even an option while traveling? It is. It actually really is. And I definitely know about peritoneal dialysis being an option, but I've learned like home hemodialysis, it might be able to be accommodated, but you might need to bring your supplies with you for home hemodialysis. I was talking to Rachel right before this, and I told her I learned that, some places you can actually go camping, even if you're on home hemo, where the campsite offers the water needed for dialysis and electricity. I thought that was amazing. So it might be an option, but you should always know where the closest center is in case you run into some issues. Maybe there's something going on with your fistula. Maybe the dialysis isn't working the way it's supposed to. Maybe it's alarming. You need to know where the closest dialysis center is so you have a way to troubleshoot. So make sure you talk to your social worker, even if you're on home hemo, before you travel. Peritoneal dialysis. A lot of patients choose peritoneal dialysis because they want to continue to travel. And peritoneal dialysis is a very easy way, so to speak, to allow for that. What I've learned, though, is a lot of the centers, if you're traveling for less than a week, they want you to bring your own supplies for peritoneal dialysis. And so that's something you want to find out about. Again, talk to your social worker, talk to your provider or nurse about what you need to supply for peritoneal dialysis. If you are on continuous ambulatory or manual, where you're doing all of the exchanges manually and you're not on the cycler, make sure you have more than enough equipment with you. Bring extra bags just in case. Delays happen. We know that, right? The global outage just happened and people were delayed for days. Can you imagine if you were on dialysis and you were delayed for days and you didn't have your supplies? You need to have all of that with you. If you're on the cycler, and again, less than a week, you're probably going to need to bring your own equipment as far as your bags and stuff, but hopefully they'll be able to provide a machine for you wherever you go. But you want to make sure you call your machine provider and or your bags provider to make sure that you can get all of that equipment or if they'll deliver it ahead of time. You also might consider, if you're on the cycler, to change over to manual exchanges while traveling. And what does that entail? Most patients have been trained on manual before they even go onto the cycler. And so you want to ask your nurse, what do I need to do if I would rather do manual exchanges while I'm on my trip? You also want to know if you're traveling, making sure that everything is compatible, and that like the electricity, the chart, the outlets and stuff are going to be compatible. And you want to make sure that the water supply is going to be adequate for your dialysis. A lot of times, a lot of countries actually use a reverse osmosis system, which is what they use for dialysis. So that's good water. But you want to make sure that the water supply is clean. And those are things you need to know ahead of time. So, what if you're on the waiting list for transplant? You think like, "Oh, yeah, I can travel. Why do I have to think about that?" Oh, but you do. You got to think about that. If you're listed active at a center, you want to call them. Let them know about your travel plans. What are your dates of traveling? Where are you traveling? And whoever you're talking to, as far as your transplant nurse coordinator, should be sharing that with the providers. I know, for instance, when I have patients who are on the waiting list, if they've traveled to Mexico or something and they're coming back, yes, I can reactivate them, but I do ask for some infectious disease testing to be repeated to make sure that they didn't pick up a bug that I need to treat beforehand so that, if they get a transplant, this bug doesn't just proliferate and cause them to be really, really sick. So that's something to make sure to know. When you come back, you want to call the center, let them know you're back. Tell them if you've been hospitalized at all. Tell them if you had any emergency visits or urgent care visits, medication changes, new drug allergies, any of those things. And then again, ask if you need any further testing. Now, what if you decide to stay active? Maybe your center will say, "Oh, you're just traveling domestically. Do you think you'll be able to come here?" Like maybe you're going from Chicago to San Diego. Okay, well, do you want to stay active or not active? Do you think like if we called you, you'd be able to fly from San Diego to Chicago in a certain amount of time and get here for the kidney? And so that's a discussion you need to have. And so if you are active, you might want to make sure that you also then have trip insurance. So that travel insurance that covers your airlines as far as, if you have to change your plans, cancel flights, those types of things, you want to have that insurance. I know a year ago, we called in a patient and he was less than a day from traveling to Mexico with his wife. And instead, he was like, "Nope, I'm going to go get my kidney transplant because they said they have a kidney for me." They asked us, they were like, "Hey, are you able to write a note or anything?" I said, "Absolutely. We can write a note saying that you've been hospitalized for a transplant." And it's not just the hospitalization. But I then also said in that note, this patient will not be able to go to Mexico for at least, 6 months so that the airline could do what they needed to do as far as refunding, or if they were going to give him a flight credit to make sure that the flight credit didn't expire in like 3 months because he wasn't going to be allowed to travel for at least 6 months. So those things are important, and a lot of times we will help our patients so that they don't lose out on the money that they spent for their vacations. So, what about post transplant? What do we need to know about that? So, I always will tell patients ask your center about their travel policy. I know at Loyola, we prefer that international travel does not happen until at least 1 year post transplant. That said, international travel to Canada is a little bit different than international travel to Mexico. As far as food, water, cleanliness of water, like all of those things. And it's a lot easier to go back and forth from Canada to the United States than it is if something was to happen. It's easier to get hospitalized in Canada, but I think a lot of times if people go to Mexico, they're going to want to come back to the United States for their care. So those are things to think about. Domestic travel, is there any restriction on the domestic travel? Sometimes we'll say that we don't want our patients to fly for at least 3 months after transplant, but little road trips will usually be just fine. So those are things you want to talk to your transplant center about. You always want to call your insurance, and even for anything, you should always call your health insurance company and make sure that they know about your travel plans. And if you need any early refills on medications, will they authorize those early refills so you can get them ahead of time? I have patients that go to Poland, and it's the year after transplant. And I will tell them, like if you're going to Poland, make sure that you have enough medications. Maybe you need to pick up another supply, especially if you're going for like over a month and if you're filled at monthly intervals, you're going to need to call your health insurance to make sure that they can refill your meds early so you can take them all with you. Call your pharmacy if they mail prescriptions to you. You don't want them to mail prescriptions to you while you're away. That would be awful. Maybe if you're gone for 6 weeks, you don't want to be receiving prescriptions 2 weeks after leaving and then they're just sitting there, or maybe they get stolen. Those types of things happen. So you want to make sure that your pharmacy knows you're going to be gone, not to mail your prescriptions from time A to time B. If you are staying domestically, you might need to get labs drawn wherever you go. I know some of my patients, they will winter in Florida. So they have lab order sheets from me and they will take them to like a Quest or whatnot so that they can get their labs drawn and I can make sure to follow up on their care. So make sure you know about those and you get those lab order sheets as well. Again, if you're going somewhere with those endemic diseases, know what proper precautions you should take. Should you be wearing masks? Should you be making sure that you know how to protect yourself with insect repellent? Make sure that that insect repellent has DEET in it. You don't want to have West Nile virus, especially if you're post transplant. If you're post transplant, you are at a higher risk of certain skin cancers. And so we tell all of our patients to make sure that you're wearing sunscreen regardless, but especially if you're going to these really sunny areas, you might want, not only are you going to bring sunscreen, but you want to do frequent reapplication of that sunscreen. You want to make sure you're not forgetting parts such as behind the neck, behind the ears, the top of the head, the scalp, those types of things. You want to make sure everything is covered. If you're in the ocean, please wear water shoes or water socks so that you are protecting your feet. And I can't even stress this enough when it comes to my diabetic patients. You really, really need to make sure that you are protecting yourself in the ocean. You want to make sure that you know what the conditions are. If you are not having the best balance, please don't go somewhere where the current is going to knock you off and you could hit something. Because if you get any injuries, you need to come out of the ocean right away and you need to inspect right away to make sure that you didn't get any cuts. Especially if you're post transplant or you have anything else that could make it so if you have a weakened immune system, because that's an easy way to get cellulitis or a worse infection, and you don't want anything to happen that could threaten you and your health. Where you could get sepsis, you could get a limb taken off, any of those things. So please be careful when going into the ocean. Pools are generally okay. I have patients ask me about this all the time. Um, Obviously, if you have a PD catheter or a dialysis catheter, you're not allowed to go into pools or the ocean. But otherwise, generally okay. And it doesn't matter if the pool has chlorine or salt water, either one is fine. If you are traveling internationally and the time zone is going to be quite different, you might want to talk to your transplant center about the timing of your medications to find out what you should adjust your medication to. Do you adjust it to the local time of the place that you're traveling, or do you keep it with the time of where you actually live? Other considerations. So the diet, whatever diet you need to follow, please make sure that you're following that diet. Also know if the water is safe or not when you're washing like produce or anything, because if you're washing your produce and the food isn't safe, you have to make sure that it's thoroughly dried. If you're brushing your teeth, you might want to make sure that you're actually using bottled water that might be safer rather than tap water. So those are things that are important. Make sure the food is cooked properly. We have certain um, We have certain considerations when it comes to food and how it should be cooked, but not every country follows that. So you really want to make sure that your food is cooked properly. Know which over the counter meds you can actually take for yourself, So I will tell patients, make sure you travel with some Imodium. It's really easy to get here, maybe not so easy to get when you're traveling. And so if you know that you can take Imodium and it's safe, bring it with you. And all of your medications always need to be in your carry-on luggage. None of your medications should ever be in checked luggage. It should always be in your carry-on. If you're traveling internationally, your medications should be in their original packaging where it says what the medication is, the dosage, everything, in case you are at customs or, going through security, that if they rifle through it, they're not going to think that it's something else. If you have it in its original packaging, it says exactly what it's for, and people can tell then it is a prescribed medication. If you have refrigerated meds, make sure you have ice packs or a cooler with you. And then, of course, like if you form blood clots, make sure you're wearing those compression socks. Make sure you're ambulating. You might want to consider aspirin. Those are things as far as just, remembering as far as travel considerations. So I did touch upon the fact that travel medical insurance should be considered. And so the reason I think this is so important is because I don't think enough of us know about it. And so travel medical insurance or global medical assistance, what does it offer benefits with? So maybe there is a patient who has a heart attack and they are in, I don't know, Tokyo. It'll help as far as hospitalizations, making sure that you are at the correct hospital for the heart attack. I know for a fact that if you go to India and you're traveling, they have some of the hospitals don't do all of the care, and they actually have to they have to move you from one hospital to another. So maybe you go to a hospital and you're having a heart attack, but this hospital just does general care. They might actually transfer you to a cardiac hospital. So you want to know those things ahead of time, but also your travel medical insurance can help with that. And you can get them on the phone to figure out where are you supposed to be, or they will call and they will discuss with the doctor what the plan should be because they have nurses and doctors that work for them on the travel side. It can also help with emergency medical evacuations. If there's something going on, maybe um, there's an earthquake and it's going to threaten your water supply if you're on dialysis, guess what? You need an emergency medical evacuation. And so they can help assist with that. Repatriation, if you need to come back to the United States because you're sick and whatever country you're in is close enough, but it's also doesn't have the care that it needs to provide to you, they will help repatriate you back to the US. If you live in Chicago, you might not come back to Chicago. You might end up in Miami if you're in the Caribbean or something. But again, at least you are stateside, and the healthcare here is fairly standard at most places when it comes to care like that. They can also possibly cover your urgent care visits, prescriptions, and then also flight accommodations or rearrangements. Let's say you were on vacation, you slip, you fall, and you've broken your knee and you need to be in a knee stabilizer. Well, if you have travel health insurance, they can maybe think about switching your flight accommodations so that you go from economy to maybe business class because you need a bigger seat with more leg room so that you can actually keep your leg the way that it's supposed to be. So those are things to consider as far as the global medical assistance. It's usually at a much it's a small cost for a lot of coverage, but you need to look and find out what is the appropriate coverage for you. How many dollars of coverage do you think you need, and how much does it cost? You can call your own health insurance company first and find out what their global health coverage, what their global health insurance costs if they have a plan. Find out how much it costs, find out how much it covers. And what does that coverage mean? Does it cover all these things? Maybe it only covers urgent care visits, but not the full hospitalization. If that's the case, you might want to start shopping around for other plans. And so even if you have insurance through Cigna, maybe you go through Blue Cross Blue Shield for your travel insurance because that's just the better plan for you. and that's fine. But when you're talking to the travel insurance, that meaning the global health insurance company, you want to say, how is this going to interact with the fact that I also have Cigna regular health insurance? And most likely internationally, it won't matter. They'll just take the international coverage. But if they have to repatriate you stateside, then maybe it turns over back into the Cigna. So those are all questions and details you're going to want to find out. These are a list of resources, so not only ones that I had gone to, but just ones that I had seen listed. National Kidney Foundation, at their website, if you search travel tips, they have a whole list of everything. A lot of it was in this presentation as well. For Fresenius, Fresenius patients, you can have travel services through them, and so I included the phone number. Next Stage, if you're on Next Stage dialysis, then you can go to that website. DaVita has their own phone number for guest services. Baxter, I included that number, and especially for PD patients if you have a Baxter Bags. Travel site to help you find dialysis centers abroad. I came across that and I thought that was interesting. Bookdialysis.com. And then Dialysis at Sea Cruises. Those are also there. A few other websites that think I came across was like dialysisfinder.com. I actually use quite a bit to help me find dialysis centers in the United States. Um, and then you can also just Google, like, how do I find an international dialysis center? Or, how do I do this? How do I do that? So search engines are your friends when it comes to traveling with dialysis or a transplant. And that's it. Thank you. Any questions?
Thanks so much, Divya. And I'm just going to quickly pop on and say if there are any questions, you are welcome to type them in the chat, or you're also welcome to unmute yourself and ask your question directly. And maybe we can ask Monica to perhaps share some stories about her personal experiences if she's okay with that.
Sure. So when I was on dialysis, I traveled, to say a family reunion. My daughter graduated from college. We owned a home in Florida, so I actually went and stayed there for many weeks. And so it was always either kind of a short trip, or when I went to Florida, I stayed for several weeks. But when I went to my daughter's graduation, it was kind of a short trip. So it was a little tricky, you definitely had to schedule your dialysis, but you also didn't want to miss most of what you went out of town for. So that was what I found to be challenging. So if I, would consider going somewhere, I had to be able to get not only just get my dialysis in, but feel like I would get the most out of the time that I spent at the location. And so the funniest thing to me was that when I went to visit other dialysis centers, I always took note of the way they treated me and other patients. And I would come back to my own dialysis center with a lot of notes and a lot of information and guidance for the people who worked at the dialysis center where I went to regularly. And I do think that by the time I left there 3 years later, it was a little bit of a better center. But in terms of traveling, with being on hemodialysis, which is what I was, the biggest part was just the scheduling of your time.
Thank you so much, Monica.
Yeah, I think that's really important to consider, and like I said, there might be more than one dialysis center near where you're going. And so it's important to think about, like, okay, wait, no, that's going to interfere with my daughter's graduation. I'm not going to catch it. Let me see if there's a different center that's maybe not too much further away that might have a better accommodation for me. So realize that hopefully you should have choices. But again, I think using those like resources, especially if you're in center and you're with Fresenius or DaVita, the fact that they offer those resources and that they're trying to find um, like accommodate people who travel. I think that's important so that hopefully they can give you a great travel experience.
And you listed, one of the resources you listed was the dialysis at sea. And I looked into that while I was on dialysis, and it's really expensive because your insurance does not pay for dialysis when you're at sea. So you have to pay out of pocket for dialysis in addition to the cruise. So I think a lot of people are able to do it, but at the time that I was on dialysis, I wasn't able to swing that. But it is a nice opportunity for people to be able to have, because I do see people go on cruises, general cruises, and they try getting dialysis just before they get on the boat. And then they go for 4 or 5 days and they come back and they're usually sick. So the dialysis at sea is a great option if you can afford it.
Yeah, I would be interested in knowing if maybe any of those global like health insurance, travel health insurances, would they cover that dialysis then? Because that would be an interesting question, or at least partially cover it.
That's a very interesting question.
All right, well, if there's no other questions, I want to thank you.
Thank you so much, Divya, for your presentation today. And I'll just do a quick plug and a save the date. We'll be in person for our next Kidney Connections seminar at on October 19th at Hyatt Regency O'Hare. So looking forward to seeing everybody in person. Thank you.
All right, thank